And also remember, they're going to be learning. So there's a potential for them to make associations between that negative emotional sensation and being in the veterinary practice through classical conditioning. So classical conditioning is the really passive form of learning that happens whenever two things happen at the same time. It's not about the consequence of that happening. So operant conditioning is a much more active form of learning where the consequence of those things happening together determines whether or not you select that behaviour the next time. It's classical conditioning that's the one that forms the associations with your emotions. Okay, so when you're in a fearful or anxious state in a certain context, there will be this passive form of classical conditioning going on. And that's why the bias is so important, why we're trying to create that bias towards more positive emotion in the veterinary context. So again, it goes back to how do we minimise stress in the veterinary practice? It goes back to prevention every time. The way we get the veterinary practice experience to be the best it can possibly be is for those animals who are not sick or in pain to not have negative emotion already, so that when we do get the negative emotion inevitably from being ill, that's all we're dealing with, not with the unnecessary negative associations with being just in the context of the veterinary practice. So we can do that by learning to accept restrictive handling really early on and making sure that we introduce it in the right way. So again, remember the difference between habituation, which is what this is, and sensitization. What's the difference? So where's the risk of sensitization in terms of how we handle young puppies?
If you do it when they're in a negative emotional state, it reinforces the fear.
It increases a negative association, yeah. So what's important is we do this really slowly. We increase restrictive handling slowly. It's not just a case of, oh, as long as puppies are used to the fact that we lift their ears and we do their teeth and we do all of that, it's just we have to do it because then they get used to it. No, they have to make this positive emotional association with it. So the way we introduce the handling is really important when they're young, and that it's done at home as well, so it doesn't become contextually specific. We want owners to do this, caregivers to do this at home as well in an appropriate fashion so that they get that association. And we want them to do it really early on. So we want our breeders to be doing this as well, because it should be in those first few weeks of life. The restrictive element is important. It's not just handling them and touching them, but actually holding them, because that's what we need to do to get our job done. So touching for just social contact is important, but some level of restriction is also important for us to be able to do our job later on. And if we can, get owners to do daily examinations. So how many of your clients will do toothbrushing? What's your uptake on that? Pretty low. And what have you tried in terms of incentives? Do you have nursing classes, or do you have literature and things like that? So do you proactively push it, or do you just go, it's too difficult?
I kind of talk about it in line with stuff like looking at ears, holding paws, and kind of throw it in with all of that rather than separate.
Yeah. It's hard, isn't it? And I think the other thing is we tend to say it at puppy classes or in those first vaccination appointments, and then we have this problem in the veterinary world that we lose contact with our patients at probably the worst point in their life for us to lose contact. So we have quite intense contact with them in the first few weeks of life. So when they're coming straight from their breeder, the beginning of the relationship. And if we do puppy classes, we might extend that a little bit, but often we lose them and we don't see many of them until the first vaccination. And actually, if we haven't been keeping that contact up and suggesting this is important, then you could have had an animal that had quite a lot of handling when it was a very small puppy, but then actually has had absolutely nothing, and you having your first vaccination appointment is actually the first time that any restrictive handling has happened again. So it's finding ways of keeping contact with our patients when they're well, and this is a problem for a veterinary practice because we are seen as somewhere that you go when you're sick rather than somewhere that you go for health care. So keeping that almost the with young children, you have the midwife coming at the beginning, and then you go on to having the district nurse coming that try to keep that going, and then you go into the school nurse, etc. So there's a kind of ongoing contact. Little red book, it's probably not a red book now, that's 30 years ago, but the little book that you have that you put all your stuff in goes with the child, and there is that ongoing contact. We really do lose contact at the time when this is really important. So how many of you do have nurse clinics for adolescents? Invite clients back? No? You do, yeah. A few practices have started doing it. So having them back at the time. Now, one of the things is obviously the world of neutering has changed. So we're not so keen on blanket neutering of animals at 6 months of age for behavioural and medical reasons. And so that may lead to an even less contact with them around that age, because if they were coming in at that time because we were neutering them, that was one way we were getting contact with them in that first year. But now we're moving away from that as a blanket approach for good reason. There's a possibility that actually we're going to lose contact with them altogether. And so nurse clinics, I think, is probably the best way of doing this. Because it's a way of giving a more informal, we're not suggesting they need to come and see a vet, but we want to be involved in health care rather than just response to illness. There's a difference between those two things. The veterinary profession, if the veterinary profession is responsible for health care, that means it's also responsible for that whole triad that we talk about, the cognitive, emotional and physical health triad. And that doesn't stop between your second vaccination and your first booster. That's a really important age. We see a lot of onset of difficult behaviour, challenging behaviour at home in that first year of life because of the fact that we're not getting the right information out at that time.